So let's discuss a very important anti-amoebic drug, that is metronidazole. So we will study metronidazole in the under the following headings, that is mechanism of action, or MOA, mechanism of action, and uses, side effects, and clinical scenarios. So these are the following points under which we're going to study this. So the mechanism of action of metronidazole, if you want to say this in one word, it inhibits nucleic acid synthesis. So in one word, it inhibits nucleic acid synthesis. Now in the detail, let's study it in detail. So first the drug has to enter. So first it has to enter, there will be entry. So how does it enter? Via passive diffusion. It enters via passive diffusion. So it enters via passive diffusion. Maybe it's a trophozoite. It can enter into a trophozoite or an anaerobic bacteria. So then it needs to be activated. Then activation. So for activation, you have to remember a name, that is P4. It stands for pyruvate ferredoxin oxidoreductase. O R oxidoreductase, P for pyruvate, and F for ferredoxin. The spelling of ferredoxin is Ferredoxin. So this is the name of the enzyme that you have to remember. It comes as an MCQ. So inside that, either it can be trophozoite or an anaerobe, the nitro group of the drug is reduced by the enzyme pyruvate ferredoxin oxidoreductase. While this reduction takes place, there is generation of a very highly reactive nitro radical anion. Very highly reactive nitro radical anion. So this nitro radical anion, it then this reactive radical intermediate then reacts with intracellular target molecules, specifically causing DNA strand breaks and loss of helical structure. DNA is like this, the helical structure. So there will be loss of this helical structure, and the strands will break. This double-stranded DNA, there will be break in a strand. So this will bind to the DNA and will cause two things. One is DNA strand break, and another one is loss of helical structure. Thus, it will lead to nucleic acid synthesis inhibition, strand and loss of helical structure, and will lead to nucleic acid synthesis inhibition. So this is the mechanism of action. This is very important. The mechanism of action you have to remember. Now let's come to the uses. So there is a mnemonic. The mnemonic is get, G-E-T, get a gap. Gap is a company that makes t-shirts and other things. There's a company, so get a gap. G for giardiasis. E for Entamoeba histolytica. T for Trichomonas vaginalis. Then A doesn't stand for anything. Then gap. G for gingivitis. A for anaerobic bacterial infection. And P for pseudomembranous enterocolitis. So this is a mnemonic. You have to remember this mnemonic. The uses of metronidazole comes as a short note. So these are the uses. The mnemonic is get, G-E-T, get a gap. This is a mnemonic. So giardiasis, this is a drug of choice in case of giardiasis. Drug of choice is metronidazole. Entamoeba histolytica, causing intestinal amoebiasis. Here also it is a drug of choice. Trichomonas vaginalis, here also it is a drug of choice. So you can see how much important drug it is. It's a drug of choice in giardiasis, entamoeba histolytica, and Trichomonas vaginalis. Entamoeba histolytica, both intestinal amoebiasis and amoebic liver abscess. In both the cases, it is a first line drug. Then gingivitis, acute necrotizing ulcerative gingivitis, it is used. Anaerobic bacterial infections like brain abscess, peritonitis, pelvic infections caused by bacteroides fragilis, Clostridium. Then pseudomembranous enterocolitis caused by Clostridium difficile. Though oral vancomycin is often preferred now. So these are the uses. Now side effects. So the side effects are first GI side effects, neurological side effects, and hypersensitivity, and others. We can divide it like this. First GI, then neurological side effects, GI side effects, neurological side effects, then hypersensitivity reaction, and then others. So what are the GI side effects? GI side effects are nausea, vomiting, diarrhea. These are the GI side effects. Abdominal cramps, anorexia. But a specific side effect you have to remember, that is a metallic taste. Metallic taste. This comes as an MCQ. This is a specific side effect, metallic taste. Neurological, headache, dizziness are the neurological side effects. Headache, dizziness. But at high doses or prolonged use, peripheral neuropathy, ataxia, rarely seizures can also occur. In those cases, you have to stop the drug immediately. Hypersensitivity reaction like urticaria, pruritus, these are the hypersensitivity reactions that can occur. And others are like dark brown discoloration of urine. This is harmless, dark brown discoloration of urine. This is harmless. So these are the side effects. GI, you have to remember this metallic taste, and others are nausea, anorexia, abdominal cramps, and others. Neurological, headache, dizziness, and but in high doses, at high doses, you have to remember that point. The seizures can occur, neuropathy can occur, peripheral neuropathy. Then hypersensitivity reaction, urticaria and pruritus, and others are dark brown discoloration of the urine. That is harmless. So we have discussed the mechanism of action. Mechanism of action is done, and uses done, side effects done. Now I will tell you some clinical scenarios, and you think which drug you will use. So the first clinical scenario is a medical student develops foul-smelling watery diarrhea with bloating after trekking in a hilly region. Stool microscopy reveals Giardia lamblia. Which is the preferred regimen? The options are flurazolidone 100 mg TDS 5 days, secnidazole 2 gram single dose, metronidazole 400 mg TDS for 7 days, and D is tetracycline 250 mg TDS for 10 days. So our mnemonic, get a gap. In that we know that in case of giardiasis, the drug of choice is metronidazole. So the answer is metronidazole 400 mg TDS for 7 days. So other question. During a mass surgery camp, a patient develops post-operative brain abscess due to anaerobic infection. The drug most effective in combination therapy is A. vancomycin, B. metronidazole, C. ceftriaxone, and D. clindamycin. The answer is metronidazole. So this is an anaerobic infection. So our mnemonic, get a gap. We have anaerobic. The A in the gap stands for anaerobic bacterial infections. So the answer is metronidazole. And then another question, another clinical scenario: a rural health camp reports cases of acute necrotizing ulcerative gingivitis, that is trench mouth. Which regimen provides rapid relief? Here also the mnemonic, gingivitis, G in the gap. So the regimen is metronidazole 200 to 400 mg TDS. So these were some clinical scenarios on this topic. I will now show you guys the notes. Whatever I have taught you, whatever I have discussed, I will show you in form of notes. So here are the notes. Metronidazole, the mechanism of action is written here. The enzyme P4 enzyme is very important. This comes as an MCQ. The therapeutic uses, get a gap. A is not written here. Get a gap is the mnemonic. Everything is written here. And the adverse effects are also written here. One adverse effect I forgot to tell, that is disulfiram-like reaction. This is written here. So metronidazole strongly inhibits the enzyme aldehyde dehydrogenase. If a patient consumes alcohol while taking metronidazole, the normal metabolism of alcohol is halted at the acetaldehyde stage. So we know how alcohol is metabolized. Alcohol first gets converted to aldehyde, then it gets converted to aldehyde, then it gets converted to acetic acid. So this alcohol to acetaldehyde, alcohol means ethanol. This alcohol to acetaldehyde, this reaction is catalyzed by the enzyme alcohol dehydrogenase, and this acetaldehyde to acetic acid, this reaction is catalyzed by aldehyde dehydrogenase. Now metronidazole strongly inhibits the enzyme aldehyde dehydrogenase. So what will happen if acetaldehyde cannot get converted to acetic acid? Then it will accumulate, acetaldehyde will accumulate. This accumulation of acetaldehyde in the blood causes a highly unpleasant disulfiram-like reaction characterized by throbbing headache, flushing and sweating, severe nausea and vomiting, and palpitations and hypotension. This will happen. So this can come as an explain why question, like patients must be strictly counseled to avoid alcohol during metronidazole therapy. Explain why. So this is the reason why patients must be strictly counseled. And even after completing the course, for at least 48 hours, that is 2 days, you have to abstain from drinking alcohol. You have to tell this to a patient.